What I love about nursing is that you are the person that is there when patients are at like sometimes the worst point in their life. And you can be there to give them like a little glimmer of hope.
Okay, let me do this. Why was I picked to do this? My grandma was chronically ill and she was hospitalized, and the nurses and the healthcare team just were so compassionate and helpful, amazing, and I wanted to be just like that.
When I first started, I didn't know what I was getting into. That first shoot, like this, sorry, hang on.
Just pillow speaker.
Oh, emergencies. It happens.
To be honest, this is my dream job. Being able to provide care in my own language, I feel it make a lot of difference.
I wanted to be a flight nurse, and then I realized that I get very car sick, so I figured that was probably not a good choice.
I like talking to my patients and like getting to connect with them. I think it's really nice.
I have 5 kids and mouths to feed.
I originally had wanted to be a social worker, and when it was time to go and get my master's, I looked in the paper and there was a whole lot more job opportunities in nursing.
Star in progress here, thank you.
No thanks.
So I originally started as a paramedic. I saw a lot of people in need out in the community, and I thought that advancing my career as a nurse was the best way that I could kind of give back to society.
The nursing aspect brings you technical challenges, brings you emotional challenges. I pride myself in being able to getting through those situations.
I am a third-generation nurse. My mom's favorite thing to tell me was, this will be the hardest job you'll ever love.
People will say how hard it is to be a nurse and everything, but it's so satisfying. And it's just a wonderful profession.
Being with patients at critical times of their lives is pretty sacred, honestly.
Nursing is more than just treating a disease. It's more than just doing a procedure. It's more than just tasks. You're really treating the whole person, and you're really getting to know them as who they are.
I used to work with the pediatrics and a lot of the cancer kids, and you leave that room and they give you a hug and they thank you for what you've done. It's an indescribable feeling.
There was a young lady and I was trying to convince her to stay, and she was like, I don't know why I am across the room from your office, but fine. Then I was like, no, you need to just stay here, just stay another day, and she actually wrote me a note, a thank you note, on a white paper bag written in red pen that I keep in my office to this day, that is plastered on my cabinet right now. And she said, thank you. I must have been put across from your room for a reason. Thank you for talking sense into me. You were correct the whole time.
I had a patient during COVID that she just wanted a hug. So I gave her a hug, and that kind of made her day.
It was one of my first times as a charge nurse. The patient passed. It was an infant, and the mom really felt comfortable with me and trusted me, and she wanted me to walk down to the morgue and take her baby because she didn't and couldn't and didn't want to leave the baby. It's probably one of the hardest things we'll ever do, but the most rewarding by far. You'll never look at life the same way again.
Sometimes there's times on my way home, you cry. Get it all out.
A tough day in the ER, you go home feeling like you didn't do enough and you don't know how to make it better, and that's hard.
I hold all of the thank yous that I get from my patients close to my heart, and it makes it easier to get through the days.
I had a patient, I wasn't really connecting with her very well, but I was still, like doing my job, being nice. And then at the end, I took her downstairs to go for discharge and she was like, thank you so much for everything. And that just it was unexpected. So I was like, oh wow, thanks. I was like, oh, what I do is worth it. It feels reassuring that you chose the right path.
And one of the really special things about being a pediatric nurse is kids really just want to play. So after each treatment or procedure, you find time to play and reconnect through child life activities or taking them off the unit or playing Uno. And that really helps center you back to the difficult work that has to be done.
We're like a physical therapist, occupational therapist, mother, dietitian, all in one. We do everything.
I treat each patient individually so they don't feel like I've sped them through here, and the feedback that I get that they feel like they're being cared for.
I feel like a lot of times after we do tests or give medications, we're kind of seen as the mean, scary ladies who have to give us something that we don't like. So knowing that I could bring him Spider-Man stickers and he was excited to see me and he waved by and stuff like that was so fulfilling and so heartwarming.
When English is not your first language, can you imagine people that are in pain or vulnerable and trying to express their feelings? I understand because I've been in your situation. So that I feel like that make it, make it easy for them.
I treat every patient just like they're a family member. They're all going through something and they're all in crisis. That's what keeps you going, getting them from the worst point to being able to get back to life.
I think our unit runs really well. We all work really well together. And it's nice to know that I have a family here as much as, my own family at home.
One day, I'll be a patient, potentially, and one of my students may need to take care of me. And so I want to make sure that they maintain that level of excellence and integrity that we've upheld.
I say what gets me through difficult days truly are the people that you work with. You're bonded through common trauma and common difficulties. And then you're able to really feel the support from, your work family because they've been through the same thing.
I love my job and I love the people I take care of, but it definitely is the team and the teamwork that keeps me coming back every day.
Our team is really good. We're kind of like a family up here. So it really helps to just have people to talk things through.
I like the teamwork aspect of, working with your coworkers to make sure that the patients get the best outcome as well as the families.
If I don't know it, I'm going to get somebody that does know what to do. And I know that they're here a phone call away or just a button away.
Everybody's great about allowing us to kind of decompress to one another. And that allows you to take a moment, take a deep breath, and realize that that situation was in one room, and now we have to go focus on a completely different situation in another room.
I work with quite a few nurses that are my friends outside of work. They are my girls' trip friends. They are my let's go away for the weekend, let's go have lunch together.
I can't speak highly enough of my coworkers. We get to do work we love all day and hang out with people we love all day.
I really lean on my coworkers, specifically Alice, who I work with. She and I actually went to nursing school together and she's one of my best friends in the whole world. Being here and being able to talk things out with her, never feel like I'm alone in these situations has been really lovely.
It's really reassuring when I run into nurses that I used to precept, and years later I'll run into them and they're like, you were a great mentor to me, and that was kind of pleasantly surprising. I always try to be a good nurse, but sometimes you're just not sure, so that was nice to hear.
I have a clinical group who I felt like they were my favorite clinical group. They gave me a notebook at the end of their clinical, and then on the inside of it, it said, "We hope we can be as great of a nurse as you are." And so that really touched my heart.
We spend more time together than we actually do with our families sometimes. A lot of times when we're on a transport, we don't even have to talk to each other. We already know what the other person is doing. And I have not worked anywhere where that kind of teamwork has been a true partnership.
We work really great together as a team here. When the minute your foot hits that unit, you are on and running. There is no pause. The patient comes first. Their needs are always number one.
When you're in a room and everything is hitting the fan, you know that you have good support behind you.
We lean on each other and our coworkers, and that's probably the biggest support system that we have.
Knowing that you have people that can relate to you and understand what you're going through. Because, going home, your significant other or your family, they may not understand, but having your coworkers is such a huge help. And we really do run our butts off for each other. So that makes a big difference.
Even just me, out in the world, I'm just thinking nursey things, oh, what's going on with them? Or they look like they're breathing a little hard. Just little things like that.
No matter how bad I don't want to come to work, the moment I step in this building, everything is okay.
What brings me the most joy in my work is being able to help patients.
It's just a matter of that you've made a difference in someone's life, no matter how small it is.
Hopefully you don't see them again, but only because you really like them.
Probably the number one thing that brings me joy in my job is just the ability to connect with these patients here.
What brings me joy in my work is knowing that I'm about to make a difference on their life.
The joy that you bring to people in the hospital is if you can make them happy during a bad situation.
I love seeing people progress. I love helping people get better and getting back to their baselines.
Just seeing how thankful patients are sometimes with something you thought was just so small, but was so huge on their end.
Even on their worst days, some kids can just light up a room and make you feel like you're there for a reason.
Joy here is really coming here, doing a good job, doing purposeful work.
My daughter's 5, and this is what she tells everyone she wants to do already.
What brings me joy is entering a room, meeting a perfect stranger, and leaving as a friend.